Welcome back to Yahoo Finance Live, everyone. Could we be undercounting the number of COVID cases in the US? Well, to get you up to speed on what's been happening with COVID and mandates, let's bring in Yahoo Finance's own Anjalee Khemlani. Anjalee, what can you tell us?
Well, to answer that question, Rochelle, definitely the answer is we're definitely undercounting. We know that a lot of people are using at-home tests. So that is really why there's a concern about what the current spread is, which has spurred, in effect, the extension of travel mask mandates. So when we're looking at airlines and public transportation, the CDC did extend that for another 2 weeks, waiting to monitor what the uptick really looks like. And we heard from Dr. Anthony Fauci recently in an interview with us talking about what one of those key metrics were going to be. Here's what he had to say.
When you're talking about masks in public transportation on airplanes, that really relates to the level of infection that's in the community.
So as you hear, level of infection in the community, which is still seeing an uptick right now, despite that possible underreporting. The mandate was supposed to expire by April 18th. Airlines were lobbying for it to in fact go away. But as we see now that it is still in place for another 2 weeks, really interesting to compare by comparison overseas over in Europe. Some airlines have had to cancel flights after relaxing mask mandates due to a shortage in staff and uptick in cases. Meanwhile, we also know the public health emergency, which was in place since January 2020, has also been extended for another 90 days. That was supposed to expire this week, but the Biden administration has continued that. And that is something that we have to keep an eye on, because it seems like there's sort of this tug of war, if you will, between what Wall Street and what the economists really expect, which is that this could go away by July. And that would have broad implications for the free testing, free vaccines, and free treatments that we all have come to enjoy. So that's where the focus really is. What will spur that is going to be interesting. We have to look for May to see what the action is, because it could be by July that this goes away for. In a report, not a note, Raymond James analysts did say, quote, the public health emergency was declared in January 2020, and with the decisions being made by the political appointees, politics is likely playing a role. In fact, we believe if the administration makes the decision to end the PHE in the next few months, it will be based on political considerations and not likely the consensus of the scientific community. And that's important because the scientific community is really already looking forward to a fall surge and the need for fall boosters. So that's important to keep in mind on what really is or could be the end of the public health emergency. Back to you.
All right, extremely important updates there. Yahoo Finance's own Anjalee Khemlani, appreciate the breakdown there.